Hi everyone, I am Dr. Anisha, a PG resident of Oral Medicine and Radiology, and today I shall be dealing with the histopathological features of fibrous dysplasia. We had already discussed about the disorder in my previous video. We had discussed about the introduction, classification, all the clinical features, etiology, and the radiological features which are very important from oral medicine point of view, and lastly the management portion of fibrous dysplasia. You can go through the video once again if you have not seen it yet. Now coming to the histopathological features of fibrous dysplasia. But before starting the discussion, I would like you to kindly subscribe to my channel for further videos. So there are few points which we need to know regarding the histopathological features of fibrous dysplasia, but let me give a very brief introduction about what fibrous dysplasia is. So basically fibrous dysplasia, as I discussed earlier also, it is a benign developmental disorder. So what happens is there is mutation in GNAS1 gene, okay. So because of this mutation, the normal bone content of the patient is basically replaced by the fibrous connective tissue. As the name says, there will be more of the fibrous connective tissue present in the bone, okay. The bone content will be very immature in nature, and so there will be various clinical features seen due to that, right? So I have told you what fibrous dysplasia is in a very crisp and brief manner. Now coming to the main topic, that is your histopathological features of fibrous dysplasia. So first and foremost thing which we see microscopically is the proliferating spindle shaped fibroblast in a compact stroma of इंटरलेसिंग कोलाजन फाइबर. सो सबसे पहले जो हमारा फीचर होगा फाइब्रस डिस्प्लेजिया का हिस्टोपैथोलॉजिकल फीचर, दैट विल बी देयर विल बी फाइब्रोब्लास्ट्स प्रेजेंट विच आर स्पिंडल शेप्ड, ऑलराइट, एंड देयर विल बी इंटरलेसिंग कोलाजन फाइबर्स प्रेजेंट, राइट. Also, one thing which is to be kept in mind is जो आपका bony trabeculae होगा, एक normal bone में it is well organized, right? But in fibrous dysplasia, जो आपका bony trabeculae होगा, that has to be irregular, fine? That has to be abnormal. So they are basically irregular bony trabeculae and they are very much scattered throughout the lesion, fine? तो जो भी bone fibrous dysplasia से affected होगा, उसके histological features में आप लिखेंगे irregular bony trabeculae. So irregular word has to be there in your answer sheet, right? So because of this irregular bony trabeculae which are scattered throughout the lesion, एक appearance नजर आता है which is typically known as Chinese character shaped or Chinese letter pattern. A very important viva question, okay. So जो pathologists हैं, they have given a term that is Chinese letter pattern. आप जब histopathologically microscopically आप देखेंगे lesion को, तो जो irregular bony trabeculae है, they are so irregular that they appear as if some Chinese letter is present on the slide, right? So that is why the pathologists have given the name. It is just a visual appearance, so they have given a name Chinese letter pattern. So this has to be there in your answer sheet. Also, it is a very important viva question, right? Apart from Chinese letter pattern, one more typical character has been given, that is alphabet soup. Now again, आप alphabet soup में आपको नजर आएगा as if जो slide है उसमें जिस तरीके से alphabets irregularly shaped present होते हैं, बिल्कुल उसी तरीके से slide में आपको irregularly shaped trabeculae नजर आएंगे. So these two things are to be kept in mind while writing answer about fibrous dysplasia. Histopathological features of fibrous dysplasia. Now the next point says the trabeculae has coarse woven bone. Now हमने trabeculae का बात किया. We talked about how the trabeculae appear, right? They are very much irregularly shaped, fine. Now in irregularly shaped trabeculae में जो bone present होगा fibrous dysplasia में, that will be woven bone. Fine, they are absolutely immature in nature. Now in my last video you can go and watch it if you have not watched yet. So I had already discussed that जो आपका fibrous dysplasia होता है mutation के वजह से जो osteoblastic lineage है वो hamper हो जाता है, उसके differentiation में problem हो जाती है, एंड सो जो उसमें कैल्सिफिकेशंस होंगे, जो उनकी मेच्योरिटी होगी, दैट इज गोइंग टू गेट हैम्पर्ड, राइट. ऑस्टियोब्लास्ट्स में प्रॉब्लम आ जाता है. तो इसीलिए जो भी मटेरियल सिंथेसाइज होगा दैट इज गोइंग टू बी एब्सोल्युटली एबनॉर्मल इन नेचर. तो आप माइक्रोस्कोपिकली आप देखेंगे कि जो ट्रैबेक्यूले है उसमें बेसिकली कोर्स वोवन बोन प्रेजेंट है. ओके, यूजुअली लैमेलर बोन होना चाहिए, बट इस केस में fibrous dysplasia में coarse woven bone will be present, right? Now the lesions are rich in spindle shaped fibroblasts. We have already discussed this with swirled appearance. Okay, one more thing which we need to keep in mind, जो fibroblasts होंगे वो swirled appearances में आपको नजर आएंगे. Okay, within the marrow spaces. Fine. Now coming to the hallmark histological features, now a cellular proliferation of bland uniform fibroblasts like spindle cells arranged in swirling or storyform pattern will be present. I have already told you. Woven bone trabeculae होगा, ये भी मैंने बताया. Then irregular, curvilinear and disconnected pieces of immature woven bone will be present. Okay, so these are the particular words which we need to write in our answer sheets. They are present throughout the fibrous stroma. Okay, and they resemble Chinese letter pattern. So basically I am recapitulating whatever I said in my video. Okay, and lastly there will be, okay, one more thing which is to be kept in mind is there will be absence of osteoblastic rimming. Fine. And the bony trabeculae are not lined by the active plump osteoblast. Again मैंने already बताया कि जो osteoblastic lineage है it gets hampered, तो जो आपका डिफरेंशिएशन होगा दैट इज गोइंग टू बी एबनॉर्मल. तो इसीलिए जो ट्रैबेक्यूले हैं, एक यूजुअल ट्रैबेक्यूलर में देयर विल बी रिमिंग ऑफ ऑस्टियोब्लास्ट्स प्रेजेंट, राइट. बट जब फाइब्रस डिस्प्लेजिया को आप देखेंगे माइक्रोस्कोपिकली, बोन को आप देखेंगे तो उसमें आपको एब्सेंस नजर आएगा ऑस्टियोब्लास्टिक रिमिंग का. दैट द प्रेजेंस ऑफ ऑस्टियोब्लास्ट सराउंडिंग in the periphery of the trabeculae is your osteoblastic rimming. तो आपको fibrous dysplasia में ये absent नजर आएगा, right? And finally there will be immature collagen present. Interwoven bundles of immature collagen are present in fibrous dysplasia. Fine. Now one thing which is to be kept in mind, usually what happens is जब धीरे धीरे the lesion becomes old, तो जो periphery के जो bone है that becomes usually lamellar in nature. Otherwise the bone which is present in fibrous dysplasia is usually woven bone or immature bone, right? So this was all about the histopathological feature which is seen in fibrous dysplasia. With this I am done with fibrous dysplasia. If you have any doubts regarding any of the topic, okay, you can get back to me in the comment section. All right, and yeah, with this we are done with fibrous dysplasia, and from the next video I shall be starting with Paget's disease. Fine. We shall be talking about the introduction, the etiopathogenesis, the clinical features, the the radiological features, the histopathological features, and finally the management portion of Paget's disease. I shall also be including cherubism in that. Let's see how does it go. But for now I am done with the topic of fibrous dysplasia. So if you have any doubts, you can get back to me in the comment section. For further videos, you can subscribe to my channel, that is BDS Lectures by Dr. Anisha Jha. Thank you so much.